I'm Dr. Matthew Pacana, and I'm a foot and ankle specialist with Coastal Orthopedics. I joined Coastal Orthopedics in 2022. I was most recently in Houston, Texas, where I completed my foot and ankle fellowship at UT Houston. So I wanted to become a physician after spending the majority of my childhood in sports and definitely getting a few injuries along the way. That kind of got me interested in the field of physical therapy as well as orthopedics. And from there, I found myself at Georgetown University, spent my time doing pre-med, and then ultimately ended up at Penn State Med School, where I really fell in love with orthopedics. Part of that was because of the people that I met in that field. Part of that was because of the interesting surgeries I saw. And then ultimately, I found myself interested in foot and ankle surgery. So I am new to Coastal Orthopedics, but I'm definitely not new to orthopedic surgery. I spent 5 years in Columbia, South Carolina doing my orthopedic training before moving on to Houston, Texas at University of Texas to do my foot and ankle training last year. I spent a lot of time in the operating room there with leaders in the world of foot and ankle. It's a really great specialty. Everything that we do in orthopedics, from foot and ankle reconstruction to sports to trauma to replacements of joints, is something that we get to do all of that within foot and ankle. In addition to that, the biggest thing that really drew me to that subspecialty was the people that I met. I really meshed with all the foot and ankle doctors I met, both at conferences and presentations, and they're kind of the biggest reason why I am where I am today. So I do think my background in sports is an asset as I take care of patients. When I was a patient under an orthopedic surgeon, it was definitely difficult to recognize all the time that it takes to get back to doing what you want to do. And so I do understand that patients are anxious, and I hopefully can help guide them along that path of recovery when it's post-surgically and when they're in physical therapy. I think that additional information that I have, being on the other side just like them, can be really helpful. What I really love about orthopedics is taking people that are at their wits' end and allowing them to get back to what they want to do. That's what wakes me up in the morning. That's what makes me happy. That's what allows me to go home and tell my family what a great day I had. At Coastal, I hope to do that even more, and I'm really excited to meet the people of this area and hopefully make them feel better.